News comes first. This is ABC 7 Extra.
Welcome to this special edition of ABC 7 Extra. I'm your guest host, Avery Martinez, mental health reporter for ABC 7. As part of our Be Mindful initiative, we're going to examine the mental health needs of El Paso, Juarez, and Spain. Research shows Hispanics are unlikely to get mental health support because of cultural stigma. I traveled across the historic homelands of Spain and Mexico to see if cultural challenges existed across borders. This report was generously supported by the Commonwealth Fund and the Association of Healthcare Journalists to help us better understand the challenges of mental health. In 2021, there were over 60 million Hispanic Americans and over 1 million Hispanic Texans. Despite being such a large demographic, Hispanics are less likely than other groups to get mental support or admit mental needs. Researchers say El Paso has a low rate of mental health care options.
If we consider putting together Juarez and El Paso and the whole borderplex of Las Cruces as well, there's a lot of people here. And I think that it's interesting that we are still in a mental health desert. We're literally in a desert, but we also are in a mental health desert.
Research from Counseling Psychology found a lack of mental health professionals in the U.S., and El Paso was considered the worst city for Hispanic patients because there were so few therapists here. In 2021, Healthy Paso del Norte's report notes stigma as a particular challenge for Hispanics. In fact, health officials wrote the population has higher rates of perceived stigma and lower rates of getting behavioral health services. Stigma also exists in Spain, the nation that founded El Paso. I wanted to see if things were different in the historic motherland. In reality, there were many similarities. Gloria is a patient at the San Juan de Dios Hospital in Madrid, and she's been receiving mental treatment. She says stigma is a huge barrier.
You don't want to be seen as someone that is not normal or not fitting into what society tells you that is right. Now, thankfully, society is more open-minded about mental health, especially here in Spain. They're opening more, but I can tell that in the U.S. It's seen in a more accepting way because people here are very critical in Spain.
Claudia wonders if cultural norms impact the mind.
It's very damaging and it doesn't help improvement. Yeah, stigma in Spain is pretty big.
In Mexico, the impacts of stigma branch out in many directions. The Juarez mental health organization Rotemnas conducted a 2,000-person survey, and the results showed serious concerns of misunderstanding mental health across the city. The Paso del Norte Health Foundation found 11% of adults in Juarez felt depressed or hopeless each day. UTEP has also studied mental health on the border. Researchers found pervasive stigmas about mental health in Hispanic culture. They hope understanding where stigma comes from can help address it. The study found people worry about being seen as crazy or being rejected. Spain is no different.
The stigma about what's the language? Madness, locura in Spanish, has been an issue for centuries, especially when with mental health problems that are very visible. That still needs a little bit of working everywhere.
In Madrid, Dr. Leticia Martinez says she believes the challenge is Hispanic culture itself.
There is expression that I don't know if it exists in English, but in Spanish is los trapos sucios se lavan en casa. That is like saying that, difficult things or difficulties or some issues that they happen at home, you just talk about them at home. So creating this kind of shame, and I think that shame, it's a very powerful emotion.
Hispanic people on both continents quoted the phrase to me. Duke University called the phrase potentially harmful to Hispanics. The university's website states, phrases like these dissuade Hispanic youth from reaching out for mental health care assistance, feeling as though they need to keep their issues private. Duke University says less than 1 in 11 Hispanics with a mental disorder get treatment. Research shows few therapists speak Spanish or understand the culture. There are not enough therapists to meet demand here in El Paso and across the borderland. Researcher estimates show that across the country right now today, there's one therapist for every 1,200 Hispanics. The situation is much worse in El Paso. For every 3,000 Hispanics, there's one therapist. That means that for me, if I'm a therapist, right now today, there are 3,000 potential patients waiting to talk to me. The Healthy Paso del Norte report also raised another concern: culture. The 2021 report states that in particular, the largely Hispanic population and culture have existing attitudes toward mental health and treatment. Historically, it's been difficult to get Hispanics connected to treatment, and it may go beyond America.
But what I can see from my parents that they got from their parents, and they're improving, is that yes, it's they say it's very patriarchal here. That's something that is not positive towards the mental health in Spain.
Dr. Martinez believes culture shapes thought.
I think that the problem with psychology or mental health, when we compare it to physical health, is that a lot of people, they assume that it's their fault.
Some Spaniards are concerned about the word stigma.
I don't like to hear it. I don't like to think about it because, well, here in Spain, I mean, there's another word like etiqueta or stigmatizar, but it's just putting a label on something or someone. In this case,
Gloria was in inpatient care, addiction recovery at San Juan de Dios. An expert at the hospital told me what differentiates the hospital is that they provide comprehensive care in all cases and focus on the patient. He says the problem is not simply psychiatric. The clinic says demand has increased, and the doctor feels the smaller the condition, the smaller the stigma. He's telling me that stigma surrounding minor mental health struggles has decreased. It's normal to go to a psychologist. He thinks the stigma is more of a problem for chronic and complex patients who hide it from society. In El Paso, a similar story. Emergence Health Network, the local mental health authority, is focused on making sure people talk.
So just the fact that there were people that maybe looked like you and maybe spoke like you that were willing to speak publicly, that made a humongous difference. It really did. And I think the willingness for people to speak up and say, I realize I need to talk to someone, hearing that message is invaluable to the mental health community.
Many Spanish mental support groups want more patients being seen in the community. Mental health meetups in parks help connect clients and the public.
Creo que sí que es un gran freno, ¿no?
Ignacio Puerta, a therapist in Spain, believes terms make people stay away from consultations because words like schizophrenia are very big and scary. He says these labels encourage people to stay quiet. These ping pong games are just one way to start conversation. Laia, a young Spaniard, hopes to become a mental professional.
Bueno, en mi caso de que tengo el diagnóstico de Asperger.
In her case, she has Asperger's syndrome, which she feels is invisible in women. She feels people are prejudiced about such illnesses and developmental disorders. She says you can't understand mental health stigma until you experience it. She feels many people struggle to start treatment, but
Open your mind, I think, because the psychology gives you another points of view.
And stigma exists worldwide. People in Madrid agree. Juan, a Spaniard, told me.
Creo que no se habla lo suficiente de ello.
He thinks that it's not talked about enough and it's normalized because he has had people in his family with mental struggles and they weren't cared for well.
Yo creo que
Jimenez Perez, a young Mexican woman working in Madrid, says that mental health is an important element in Spain and Mexico. There are many cases of depression and other concerns. She says she welcomes physical and mental health treatment going hand in hand. Lawrence is an American living in Spain.
Yeah, for me it is a concern. I mean, I have family members who have had issues with it. And it seems like, especially in the United States, coverage for mental health is not good. Here, I feel like it's better.
Now that we understand the stigma challenges, we'll take a look at how men are particularly affected across all three lands. We'll tackle machismo after the break.